Well, good afternoon, viewers. It is today is the 16th of December 2023. My name is Mumza Bosco, and I want to welcome you to this platform. During with us online, we shall be covering different topics, some of which are related to health, others related to lifestyle and lifestyle modifications. So today, being our day one, we want to cover an important topic, and that topic is called depression. Because when you read according to Uganda's statistics, that is according to the Daily Monitor, 1st of November 2023, statistics show that 30% of Ugandans have mental health disorders, and in particular depression. And it is for that matter that today I want to introduce to you someone that has worked with so many cases of depression, someone that has worked in psychiatric clinics and is well versed with what our topic is today. So allow me introduce to you Mr. Hashim Semakula to come and take us through depression. Welcome, Semakula.
Thank you, sir. Wana Bosco. My name is Semakula Hashim, as they had already introduced me. But Mr. Bosco, this is very thing. Introducing such a thing on YouTube, such that people can actually, mental health has killed a lot of people. Actually, mental illnesses have killed a lot of people. But the issue is, some people don't know it. That is something that most people have succumbed into it. How actually depression has killed a lot, despite the fact that even our health centers don't note it. Are you getting it? Our health centers don't note it because these people die from the village, thinking these ones are normal. And one of the other reasons why it happens so like that, it's like mental illnesses or the mental clinic starts at the referral. For example, in our region, if somebody is having depression, if you are to refer him to hospital, you must refer him to Mbala regional referral hospital. There is no other hospital. Okay, there is no other health center. Health center for we don't have this psychiatric office. So for that matter, therefore, depression is something very huge, something very, very big. However, in a simple definition, depression is a mental illness characterized by low mood, loss of interest, and at times we say loss of pressure previously done activities. For example, if somebody is good at football, he will no longer participate. So in simple terms, that is depression. You lose interest, you lose pressure in the previously done things due to issues that come within. Yeah, mainly that is depression. And if I can add on depression is we usually define it as like this. We usually define it like this. Depression is somebody feels the past is negative, the present is negative, and the future is doomed. So he is there just in himself. Everything is negative. The future is doomed. So simply that is depression.
Okay, thank you so much for giving us a detailed explanation of what depression is. So, Mr. Semakula, I want you to explain to our dear viewers, how can one know that they are depressed? How does depression present amongst adults, children, maybe women? How does it differ in females and males? So clearly, please explain the presentation of depression.
In simple terms, I think you're asking more of the signs and the symptoms,
yes,
isn't it?
Yes.
So depression, as I've already told you, it starts with loss of pressure or loss of interest in the previously done activities. So somebody, if let's say is a footballer, he no longer participates. If he's your playing, he no longer comes. That is one of the signs.
Mm.
Two, in depression, actually depression is usually confused with burnout.
What is burnout?
A burnout here, you are overloaded with tasks. For example, you have been employed. You have to do this one, you have to do the other one, you have to do the other one. You are stressed. But depression here, it is more of negative thinking. Are you getting it? It is more of negative thinking. Somebody might be stressed or has a burnout, is overloaded in his work, but is not into depression. But in depression, you are into negative thoughts. That's why most of the people, one of its complications is suicide. These people always want to kill themselves because they see no positive thinking in themselves. So one of the other signs of depression is weight loss or weight gain. However, most of the people think that when you are depressed, you lose weight. But you can also be depressed and you gain weight. Why? Why does it happen like that? Some people, when they are depressed, they resort eating. Eating more. He eats like counteract to that depression. He eats. So, but some of the people depression affects some people differently. Are you getting it? Depression affects some people differently. So some people, when they get depressed, they resort eating. While others, when they get depressed, they do what? They stop. They stop eat. Yeah, that is it. Then, in women, depression is usually not as much as common as to men. Why? One of the issues of which bring depression is these women, they are social. I get it. When they get an issue, let's say he has issues in marriage, he'll go to his friend and say, you know what? My husband beats me. Well, you know what? So when you talk it out, they're going to do that's what? The pressure or the thoughts, it's built up decreases. But in men, it is usually very, 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 very severe because for us men, we believe we can control. And controlling it in your mind, mainly it with your mind, it builds up. So you buried, you feel like you can't handle. So the decisions sometimes made, they are very, 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 very bad. So mainly that is how it differs in men and females. Yeah, that is it.
So does that explain the fact that when you walk around streets in town today, you find more mad men than women?
Yeah, not because most people at the street there are many different psychiatric disorders. We have schizophrenia, we have mania. However, you see, even when we are studying in schools, these medical schools of ours, you see women. After this government, should I say this government, this generation, we have how can I say it? We have given a lot of emphasis to women. Why? Even when you are studying, you see, you study guys for men. We study reproductive health, it is specifically about women. We study about OBS, it's specifically for women. But do you have any topic that concerns men? Actually, when I talked about that thing and somebody told me, men there is psychiatry part. Is psychiatry. Why? Why? And even if they are saying that men hours in psychiatry, but how many? Where does psychiatry start from in Uganda? Psychiatry starts from a referral, regional referral. You go to a health center 2, 3, 4 with your money, with somebody with a bipolar affective disorder, somebody with schizophrenia. They want to manage. Why? The health starts from the referral.
It is at the regional referral hospitals.
So I think in this government, over with the World Health Organization, over with other people, they have not given more emphasis to men. We have looked, and the boy child, actually the girl child, actually the boy child is suffering more. Because for us, mentally, actually they don't take care of us. They don't take care of us.
So what you're trying to mean that according to the health structure, we don't have mental health services from the grassroots.
From the grassroots,
they start from the regional referral hospitals and maybe the national referral hospitals.
Yeah,
and that is Butaruka.
Yeah, in Uganda that's how it is. Because if you were to generalize it, you go to a health center. If you find there a psychiatric, actually even a psychiatric clinic office, over a psychiatric, actually maybe psychiatric nurses they are there, but how it should be like this: a health center, a health center, like a regional referral should diagnose. When to diagnose is these people who come in the village, actually somebody with schizophrenia. Schizophrenia can take a lot of years to get cured. So these people have to always go to the referral to pick their wife. Yeah. It should be like this. People should always come to health center too. Health center please pick their wife. Their medication, go and take them. But remember, if you have somebody with schizophrenia, you have to go. Always go for review. You have to do it as a referral. It is more expensive. However, for my thing, we have not put more emphasis on men. Yeah, that is it. And that's what it is. But the psychiatry includes all men, but if you are to see most of the people who go into mental illnesses, who go into psych, they are men. Why? We don't stop. Two, the government is not doing what? Not doing enough to help us. So we find it like that.
Okay. So thank you for giving an elaborate description of what may be the possible, how it presents. So now I want you to clearly talk to our dear viewers and you explain to us what are the possible causes according to how we live, our social living, according to the Uganda we live in. What are the common stressors, maybe what are the major causes of depression, and how later on you're going to tell us how can one maybe avoid, prevent before we come to management?
For the possible causes, they are very many. They are very many. However, I will focus on a few, environmental or social. But causes they are very many. Actually, even it can be inherent, those things of. That's why when you go to a psychiatric clinic, when they are viewing, they ask for history, family history. So for causes they are very, very many. However, if I can list a few, one of the things nowadays, relationships. Relationships have brought depression.
Which type of relationships are you talking about?
The type of relationship am I talking about? The ones of viewers. The one you go, I have a girlfriend. I cannot live without her. I will love you until those things. I will love you until Manyarek Victoria dries up. Those things have broken because somebody feels she has done what is supposed to be done. But most of at the end, she's disappointed. Then when we come to our Uganda, because it is a developing country, we come to domestic violence.
Yes.
In Uganda, domestic violence has brought depression. Domestic violence has brought depression. Why? Income. When you are a breadwinner at home, you have not brought food, you have not brought bread. The wife says, which kind of a man are you? These things of a wife going side kicks. Those things have brought depression. Then recently there is this issue of DNA. You have had it. You test 10 of your kids, only one is yours.
You run into depression.
Depression starts from there and then. Then for you, the youth, betting. Somebody goes, he gets a school fees, after school fees. He puts his on in Hindi.
The Indian gives you what you want.
Hey, the Indian says, like, I also came here to work. The Indian says, I also came here to work. Depression. Because now you have, let's say, you have put 1.5 tuition on your Hindi, has given it. When you look in front, you see the future is doomed. When you see in the present, because the India has given you, the present is really negative. When you look in the past, at home where you go to take money, they sold the land. What next? Complications of depression, suicide. Those are the people we hear. A student of a certain school so and so was found in the hostel. Manya, such a thing is dead. The students of so and so did he put some money, he gave the money to the girlfriend, he used the tuition to the girlfriend. Now he has no future. Died. So those are the issues we are facing when it comes. Like those are the most causes of depression. Mainly those are those things in depression. However, there are many, everything, be work, be school, where you have failed, somebody has a refer, somebody has a retake, somebody can run into depression. However, the causes can also differ according to where you live, what you do, and what you depend on. Then that is it.
Okay. Well, I want to thank you again. Now to the viewer watching us from wherever they are, how can different, I'm asking you, according to you and to your own perspective, how can different stakeholders, maybe policymakers, maybe government, maybe the Minister of Health, maybe the people themselves suffering depression, how can one prevent themselves from maybe lying victim of the complications of depression? How can one address depression? Yes.
Thank you. But before we go to the government, before we go to the stakeholders, before we go to, it starts with you. But you try as much as possible preventing how the causes. For example, if they have given you tuition, actually now the technology has improved. If they have given you tuition, why don't you pay it to them? If you are to bet what you can afford to lose.
Yeah.
Are you getting it? Never bet what you cannot afford to lose. These relationship issues. Actually, for me, I have been advising boys, and girls, don't date someone whom you don't afford to lose. If you go into a relationship and you feel like, because at this age, there is a certain psychiatrist called Eric Erickson. He said he gave about 8. If you like, for example, the sixth one, I usually remember the sixth one. It is the, I've forgotten. The sixth one is the actually it is love versus isolation. So at this stage where we are, you are either dating or you are searching. Because if I ask you, Bosco, at this time, and I say, Bosco, do you have a girlfriend? Do you have?
I'll answer that question in the context of whether I have or I don't have.
Do you have a girlfriend?
Back to the question. How can one?
Back to the question. at this age, this is the age where you should be from 20 to 40, from 20 actually to 60. You're supposed to either be having a girlfriend or you are searching for one. So, get someone whom you can afford to lose. True, it is the age of dating, because at this age, if you don't have a girlfriend, it is also stupid, or it is also not good. But date whom you can afford.
Why do you say it is stupid? Because me, I think you go, you date when you're ready to. But if someone is not yet ready to, maybe financially, maybe they have other stressors already, they have enough problems to add on other problems.
True. Dating doesn't mean it's What am I telling you? At this level, you are dating for somebody whom you have in future. Actually, at this level, you are not supposed to be having more than 5 girlfriends or boyfriends.
Why should you have more than one?
Why should you have more than one? That's what I'm saying, the minimum, because that's your issue. That's the what the issue. But you should not have more than 5 if you are to have so. But even one is good. So date someone. Okay? You can if he says, you know what, Bosco,
it is done.
It is done. Now you cannot see her the iPhone I bought. You start the time I spent. Those are the issues. Now, if you start thinking of the iPhone you bought, the PC you bought, the money you pay, actually some people pay tuition for their girls. So that's where depression starts from. If you are to love, and actually if you are to give someone, give him what you can afford to lose. If you are giving your girlfriend the phone, just know, in case it happens and says it is done, the phone won't be painful to you. I get it.
Yes.
Just if you are giving him tuition, just know that you are helping as if you are helping your bro. In case you say, you know what, I got someone else, you cannot manage it to continue. You know that it is. You can lose that one, the one you gave.
Well, when you look, according to Uganda's statistics now, we are going. It states that there's what we call GBV, gender-based violence. And according to Uganda now, gender-based violence is the leading cause of depression, where we see some people end up committing suicide. They leave home, they run away from home, and I think if you have been to this, when you walk on Kampala streets now, you find there are more street kids. I think this one comes as a result of maybe gender-based violence. So now, according to you and in your own perspective, do you think gender-based violence has led to depression? And if yes, how do we come into? How can different stakeholders come into to maybe come and lay strategies to fight this particular thing?
Well, Uganda is a developing country, and through gender-based violence, as we have seen, it leads to depression. Actually, there is a research which was made. They were considering people who live in Kororo side, that rich area people, in Kororo, Muyenga side, and other people who live in Kamocha, those slum areas. You compare those kids from there, they are totally different. These people are not the same. The kid from Kamocha is not the same as the kid who has grown up from Kororo and Muyenga side. Why? These people actually it is poverty. The one which is bringing this gender-based violence. Now, Bosco, how will you fight when at night you brought fish? How will this?
The cause of fighting can be different. Maybe my partner is cheating. Maybe
even somebody who is poor. cheating in a poor family. Actually, those things are usually here in comedy. But cheating in a poor family and cheating in a rich family, they are different. Somebody can say, you know what? Forgive me. Actually, he's even using English. But for you as here, you people, poor people, the thing is very, 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 very open.
So
but poverty is one of the things which is bringing depression or gender-based violence. Gender-based violence resulting into what? Depression. However, what should the government, as I told you, it should start for them things which can get them out of poverty. As I hear them doing this Myoga funds, they have brought this one, the parish development model. They also brought things of what? Other projects to make the people out of poverty. However, we are a developing country, and I think they are trying to do their best as the government to make sure that people get out of poverty. Because poverty, where poverty is, peace is not always there.
Okay.
Why? People are not fed, kids will always cry, the mom is always complaining, people are not taking kids at school, so that is all depression.
Okay, now that is according to the how to prevent it from occurring, right? Now I want us to talk about now the cases that are already with us in the hospital, in a health facility. Yeah. Now, how do we manage someone who has suffered depression and maybe someone who has other complications that arise from depression? Yeah. In about 5 to 8 minutes, kindly explain to our viewers and someone listening.
Before actually something which I had forgotten. Depression, you see, we classify mental illnesses according to we have organic and inorganic. Or we can classify them as functional and non-functional. So if we had to classify them, it is a function. On the other side, it is inorganic. Are you getting it? What do I mean by functional psychosis? Actually, some people say it's functional psychosis, but how do we classify them as inorganic? In inorganic, we are meaning if we are examining you, we don't have any illness. Or if you are to do any test, is negative. But still you have the issue. Those things including mania, schizophrenia. However, depression can be organic induced. Like somebody has cancer, somebody has HIV, you can say HIV induced depression. It is the organic disease bringing in
the aspect of depression.
So here at times, if it is organic bringing in the other depression, somebody has HIV. Deal with the HIV, if the HIV cancer. If somebody has he has cancer, because if it is above those stages which cannot be treated, just treat cancer.
Put them on palliative care.
Put them on palliative care. However, before the treatment, before anything else, there is something which we can do before the treatment. Before those things of treating, somebody who has depression, maybe has lost a wife, you have lost a beloved one, breadwinner, you have maybe you have lost money, any kind of depression, the thought which is because depression is a negative thinking. Here there are some things we can do. One of them is cognitive therapy. We have psychological therapy. We have also group therapy. For example, going into friends, you feel like something is stressing you. Go into friends, start discussing. As we discuss, actually some people resort to taking alcohol because it is depressed. It results into alcohol does not stop it. Does not stop it. Actually, it postpones it. If you are, the issues don't go, it just postpones
for tomorrow.
To tomorrow. If you lost to a Mindi at night, if you take out or will it remove it? Will it remain have lost? It just postpones the depression. However, we have also somebody who is already depressed. You see, somebody has finished the week, is just there quiet. Those are actually depression differs in introverts and extroverts. However, that one is in. But in introverts, an introvert is somebody who doesn't socialize. These people who is always there, isolates himself. Okay, he's not social. Then an extrovert is somebody who is social. These ones who every time he wants, he's always laughing, he wants to speak with people. Those ones, if they get depression, you can easily identify that this person is having depression, is depressed. But for introverts,
people are always quiet.
People are always quiet. You get depression, and you might not notice
that they are depressed.
They are depressed because you are used. That one is always like that. He doesn't speak.
That is his mood.
That is his mood always. Only somebody is going through a road. So before we go into the treatment and what, since depression is a negative thought, first ask yourself: are these thoughts real facts?
What do you mean?
For example, I had a girlfriend. She checked me. Now, which Bosco who has taken you going to enjoy. The whole command have put in the Kagal. The Bosco is going to enjoy. True, Bosco is going to enjoy. Then ask yourself another question: is it absolutely true? Yes, he's going to enjoy. But can't you think into another way of getting another girlfriend? So now, as I have told you, the question you should ask yourself next: is it absolutely true? Or you can do what? You can change, or you can think in another way. Then the third question you should ask yourself: which impact is the thinking bringing to me? Over how is my thinking? How is my thinking affecting me? For example, okay, you develop a storyline. Which storyline is this? Sad? Is my thinking making me become sad? Is my thinking making me become jealous? Is my thinking making me become hurt? That is the third question you should ask yourself. Then the first question: what will happen if I don't stick on the thinking? Because as we have said, depression is a negative thinking. You are thinking negatively about yourself. You are thinking negatively about what you did. You are thinking negatively about what happened. So first ask yourself: is it really true that what I'm thinking? Because Mr. Bosco, one of the things which we have thought of many things which have not happened. You might think if I fail, take an example, if I fail my A level, or if I fail exams, I will have become a failure from then and then. But there are some people who have failed exams and still they are making it. There are some people who have lost a property and they have made something very bigger than what they thought it would be. So think in that way. Then after asking yourself that fourth question, what will happen? First ask yourself, what will happen if I don't continue with that negative thinking? What will happen? So you should think in your mind. Is there actually, when you ask yourself, is it really true? Is it really the fact? Will it really become true? After asking yourself, the brain is reacting by then. The brain is reacting. But remember, You are the driver. You are the driver of your what? Of your body. You are the driver of the brain. So if the brain reacts and tells you, you are done, you are going to be hurt, you are going to, the future is very negative. So, and the brain is telling you that, the brain is telling you that it is you, it is your mind, it is you are the one who is supposed to drive the brain. You are the autopilot of the what? Of your brain, of yourself. So if the brain is saying, they have taken her, it's going to enjoy. You are the one to tell your brain, no, it won't happen. I'm going to get another one. I'm going to get a better one.
So what you're trying to mean, you're trying to mean that having that positive energy and being able to push on to think otherwise.
Yeah, true. Yeah. You must first set. Actually, most of the time it is first accept the situation. I have failed. True, I have failed. What next? I have lost the money. True, the money has gone. What should I do to remove it? Actually, then the next medication or the next management we can do here is say it out. Actually, they say it out. That's how women, most of the women, overcome depression. They go and they share with their friends. Share with your friends. Here, that's where we call upon the religious leaders, the political leaders, even friends. However, friends of nowadays, the world I think has overchanged. Whenever you tell a friend will. You see, those developed countries, they have even counselors. You go with your issues, you say, you know what, this one happened, then the counselor advises you. However, which is not the issue in Uganda. But in Uganda, we can see it in this way. Get a friend, get somebody whom you know he can't say it. Or get a religious leader. The sheikhs, the reverend fathers, everyone, where you believe in, whatever domain you believe in, whatever denomination you believe in, get somebody there in the church. I hear in the Protestants they have what we call the Mothers' Union. I don't think if there is the Fathers' Union. Go share your issues. Let them, as you
counsel you.
Let them counsel.
They gather you up.
So as they do that, you become the stress reduces, the depression reduces as you continue. Actually, they advise you, hey, since you did this, let's do this, try out this. Then you become very you've overcome depression. Then apart from that, you can get something to keep you busy, or you can join a sport such that you can reduce the thinking, those things of
the times where you're redundant, the brain has nothing to do.
Always thinking of the past, always thinking what the time you invested, always thinking of what happened. So get some activities to keep you busy. Then from there, from the social therapy over the psychological therapy, I think there is also treatment. Some people don't know that we have drugs we give people who are depressed. However, I won't like to give these drugs or to mention these drugs in this video because some people may get addicted to these drugs. Once you get depressed, you resort to the drug. And self-medication is not usually, actually it is not good. In the case of depression, go see your medical personnel, go see a doctor, your therapist. The therapist will see which best combination of drugs to be given. Over, if not drugs, what will you do to overcome? Yeah, that is it. And that is generally it. And maybe if I can talk about complications of
the complications that come along with depression. If you don't control this depression, I want you to explain to our viewers what is likely to result from the uncontrolled depression, and as you give your last remarks.
if depression is not controlled, one of they are actually three, mainly the three. One is suicide, secondly is homicide, and thirdly is parasuicide. In suicide, this is where somebody kills him or herself. In homicide, you endanger or you inflict harm to people surrounding you, that is the family. Somebody poisons, somebody beats, somebody kills the family members. Then in parasite, you inflict harm on yourself without the intention of killing yourself. However, the thing which I can say about suicide, this mistake is usually done by healthy workers. Somebody comes with poison, some workers abuse, of which it is a bad practice. Abuse people who have taken poison, because they don't take poison because their mind is compromised. And two, when somebody takes poison and you treat him or her, you know those things of yours, your ravage, the gastric ravage, we have to give atropine. There is also charcoal, activated charcoal. But however, you treat, and the issue where it comes with these health workers, some of the health workers, not all, it is after treating, somebody is okay, sending him home or her home. That one is the last mistake. That is a very big mistake which should not be done. After treating somebody with suicide, or somebody who wanted to kill himself, you must first counsel him or her, because you are bringing him or her back to pain,
to the stressor.
Yeah. It's like he wanted to go. Now they have brought me back. He feels like, so once you say, hey, you are okay, you can go back home. Tomorrow he will use a better method, and you won't get him anymore. You use a better method now, which will kill him first. So how do we counsel people? I am giving a small light about how we counsel people with depression, especially those ones with severe depression is a psychiatric emergency.
Yes.
It is a psychiatric emergency. Once somebody comes with severe depression, accompanied especially with suicide, that is a psychiatric emergency. We handle it very there, and then we put a caution card. You have to remain with that person. If he has a caretaker, make sure the caretaker remains with him, so that he doesn't go and maybe poison himself or herself in another way. However, I was saying, how do we counsel? These are people, because here the thinking is compromised. All the mental processes are compromised in depression. All the mental processes, what are the mental processes? Thinking, the reasoning, perception, sensation, everything is compromised. So, how do we counsel him? First of all, we put that into consideration. The mind is compromised. You associate the thinking with the behavior and the feeling. For example, if a mother with two kids poisons himself because maybe of the husband had a child side chick or something happened, you come to the mother, you ask, why did you poison yourself? My husband, I don't want to see my husband is ever cheating. Then you ask, now whom were you going to leave these kids for after dying? Here the mother will say, hey mom, my kids, that you are bringing a reason of living. You are bringing a reason of living. You are going to kill yourself. Whom are you leaving this one? Some people always have maybe land, he has maybe cows. You are going to die because of a girlfriend. What about your dad and mom who have paid tuition? Don't you think they are going? Then you are bringing back.
You bring them back to their senses.
Bringing them back to give them a reason of why should they stay, why should they be alive. That is the way we are supposed to counsel. You associate something very important to their lives.
Yes.
Generally, that is how we are supposed to counsel people with depression. However, counselors, we have other people, they know better. But however, that is one of the way you associate a good reason, you associate something very good, something you see that is very important in their life with what they had done. Yeah, generally that is it.
Yes, thank you, our dearest viewers, and I want to appreciate Mr. Hashim for the detailed explanation of depression. It's dug deep, and I think people viewing us out there, I think there's something we've learned out of this small session. And I want to encourage you that please kindly share your comment, subscribe, like, and we have more and more topics coming in. We shall be live every Saturday we shall yet communicate time. I want to ask Mr. Hashim to really give your last comments as we mark it at the end of the show.
Thank you, sir. I want to tell our dear viewers so that they can subscribe to our YouTube channel. They can like, they can comment where things have not gone well. They can tell us what we should do, the topics we should discuss next. They can tell us how we can improve our channel. Then with time we are giving you the best of the best about health, about lifestyle. We shall be bringing other topics. But before we bring other topics, you can tell us, talk about this one. We can help you talk about it. And though we are not the best of the best, but we try of what the little we know to share with you, because we are not specialists in psychiatry, no. We just try to give you the little we know. We just try to help the Ugandans. We just try to tell you what should be done, because we are not the best of the best, but we try to help. So please help us, subscribe to our YouTube channel, like our YouTube channel, and comment on our YouTube channel. We shall be always happy to see your comments. We shall always be happy to see your likes. Thank you very much.
Well, thank you so much. I personally choose to give you a hand clap.
Thank you.
And before we close for today, I want to tell you one word. They say that we live once, and already life is too short for you to live a stressful life. Choose things which make you happy. Choose a happy life, and at the end we shall all reach the shore. We love you. God bless you.